Welcome viewers. Today it is our pleasure to introduce Dr. Sunil Richardson, who is Senior Specialist in Oral and Maxillofacial Surgery, and he is all the way from India, and he has given his loyalty and expertise to share with Starcare, and Starcare is absolutely excited to welcome you on board. Dr. Sunil, we are absolutely excited to welcome you on board, and we would love to know about yourself, your expertise and your profile in detail.
Thank you, Mr. Korean. It's my pleasure to be here at Starcare Hospital, Muscat. With regards to my training, I finished my maxillofacial surgery in the year 2001 at Mangalore, after which I went on to do a Cleft and Rhinoplasty fellowship that was based at Zurich in Switzerland. Thereafter, I finished my membership with the Royal College of Surgeons and Physicians in Glasgow and did a diplomate in national boards with India at New Delhi, and started my private practice in India after that. It's about 13 years now since I started my private practice, and with the help of God, I've been able to finish more than 10,000 successful facial surgeries, and this has primarily happened because of the various associations I've had with non-governmental organizations, especially from the US, the Operation Smile and the Smile Train, to name a couple of them. I also have visited the Yale University as the visiting professor, and I've given the grand rounds there, and I've also gone to the University of Stanford as visiting professor for a few years. So this kind of gives me the platform to have shown my surgical exposure that I've gained over the years, and I'm really glad that I'm here at Starcare, and I'm hopeful to be able to render my services to the people of Oman here.
Doctor, what is oral and maxillofacial surgery?
Oral and maxillofacial surgery is that branch of medicine that pertains to the treatment of various problems and disorders in the entire face. That's from the forehead till almost the neck. Oral surgery includes surgeries that we do inside the mouth, for instance, wisdom tooth removal, various small cysts and tumors inside the jaws. And maxilla means the upper jaw, and facial is the face. So this is kind of terminology that describes the region of our work, oral and maxillofacial. Having said that, what is our core area of specialty? It varies. For me, I'm trained in cleft lip and palate management, the primary management, the secondary management, the whole realm of it. Rhinoplasties, that is the treatment of the problems of the nose to make it slightly better looking or to make it more harmonious on the face. We also do treat patients who have problems with snoring and sleep apnea, problems to correct the jaws, orthognathic surgery, where you can move these jaws in different directions, thereby achieving not only better aesthetics and facial harmony, but also increasing the functional ability of these patients. So we are able to take both of them hand in hand. The other big aspect of oral and maxillofacial surgery is also the post-traumatic deformity, or patients have various kinds of injuries or trauma on the face, and you might have to do a small scar revision on the face or get the jaws back in the right order. So simply put, it's a combination of orthopedic and plastic surgery work, but just limited on the face. Yeah.
Doctor, what is cleft lip and palate?
Cleft lip and palate is a congenital deformity that affects approximately 1 in 800 children. It's a defect wherein the children are born with a cut in the lip, and they also have a cut in the palate, whereby they don't look well, they can't smile well, and they also can't speak well. Now here at Starcare, for instance, we have a great team of pediatric anesthesiologist, pediatrician, neonatologist, plastic surgeon, and myself. So together we are able to render comprehensive treatment for patients with these deformities. These deformities require the specialties of various specialists. I forgot to mention dental, even they are the dentist. So you need to have many specialists together so you can render a total, wholesome, comprehensive treatment for these patients. My core specialty in that is to rehabilitate these patients as normal people in the society. Many of these patients have had surgeries earlier, but they still don't, or are still not necessarily normal, in the sense they might speak with a nasal twang, or they might just not have a nice smile. So we are able to offer, through a lot of new techniques that have come about in the last few years, near normal speech for all of these patients who are born with such deformity, no matter the age. And we are also able to give them near normal lip, smile, and also nose. So this is a team approach, like I said, but we are also able to render high results for these patients with the help of this team, thereby trying to make these patients as normal individuals in this society.
Doctor, rhinoplasties. How do you perform these kind of surgeries on patients?
firmly believe that face is the chief seat of beauty and nose occupies the center of this beauty. And any surgery that you do on this nose is called as rhinoplasty or nose job. We can do surgeries on the nose to alter its shape, the way it looks. You can make it slightly broader, you can make it a little bit narrower, you can make the dorsum or the vertical part of it straighter, or if it's bent, you can make it straight. So basically you can alter the changes, the shape of the nose a wee bit to suit the patient's face. Now having said that, at the same time you can take into control the functional aspect. So the patient has a problem with breathing, then you can fix that at the same time, and you would probably have to do a septoplasty with a rhinoplasty. But still, you can get that functional aspect hand in hand with the cosmetic or the aesthetic aspect. And that I think is the real wholesome rhinoplasty. Now, we are able to do these procedures without any scar whatsoever. The reason is because the surgery is performed mostly through and inside the nostril. And so there isn't any scar. The surgery is very straightforward. The downtime is probably a day or two at the hospital, another 1 week away from work, and back they have a new nose which is very well proportional, and I think this is a surgery which is being done extensively world over.
Dr. Sunil, jaw surgeries or orthognathic surgeries, our viewers would definitely like to know about it. And when it comes to surgeries and scars and everything, our viewers definitely will be having a lot of questions in their mind, like whether it be painful, whether they have long stay in the hospital or something like that. So how do you advise our people, so that they get relief from such thoughts?
So orthognathic surgery is a surgery that involves the jaws. Gnathia means the jaws and ortho is to straighten. So basically in these kind of surgeries we try to align either the upper or the lower or both the upper and lower jaws in perfect harmonious positions. Now having said that, how do we do this? Usually the surgeries are done with an incision from inside the mouth, so they're pretty much scarless. Also these surgeries are very safe. The patients need to probably stay in the hospital for a day or two. There's so much of advancement that's now happened in this area, especially with anesthesia, with the plating system and so much of equipment that the patients would probably just need a week off from work in the severe of cases. A lot of these patients can also have day care procedures. For example, they just want to correct the chin or the menton. You could do what's called as a genioplasty. You can get the chin forward, that just takes an hour. They just need to stay in the hospital for a few more hours and usually they're ready to go home by night. So it's a day care procedure. At the same time, you have other procedures where they have a gummy smile, they smile too much and the teeth is visible a lot. Then you might have to do a procedure like a lipho-1 osteotomy or a bilateral sagittal split osteotomy, which needs about 2 days of hospital stay and 1 week of rest. So depending on the type of procedure that's going to be done, the hospital stay and the time off from work will vary. Patients, however, has to have some soft diet for a few weeks, sometimes up to 2 weeks. A new concept or a development of this is distraction osteogenesis, wherein we grow new bone. Instead of moving the bone to a new place and fixing it with plates and screws, we're also able to stimulate the body by using some devices to have new bone. The advantage of this technique is we're able to change the face and not leave any implants on the patient's face. So overall, today, with the development expertise, I'm able to move the jaws in the desired position. You can move the upper jaw up, out, back, and similarly the lower jaw. So therefore, for a patient, we can plan a particular procedure and derive at a particular plan based on what the patient needs to the function and the cosmetic needs.
Dr. Sunil, what are the common types of surgeries that can be performed in Starcare?
So pretty much all the surgeries that we discussed till now. You see, Starcare, as you all know, is a JC accredited hospital. I'm very happy with the theatre facility, with the nursing staff, with the pediatric anesthesiologist, and also with the instruments that I need to use to perform these surgeries. We have a good ICU setup, there's a good doctor's monitoring. So all of these surgeries are possible. We've done quite a few already, and I think it's just that more people need to be aware that these kind of facilities are being offered here at Starcare. And I think it's just a matter of time before we get in all more people with these kind of, who require these kind of procedures. And it's very safe to do them here. I think we can do them regularly.
Thank you so much, Dr. Sunil. It is our pleasure to have you on our board and we wish you all the very best with Starcare. Thank you.
Thank you so much.